and most honorable guests. So it's an autumnal season. It's time we're talking about healthcare. We just hear Paula's personal experience about we know healthcare related to everybody. So the project of mine today is use the visual help. So just prove to me. So I have this one for the visual help. I also have my file. It's all in here. But our project is not working. So I just trying to do my best. So for the healthcare, we know we have a surgery, internal medicine, pediatric, OBGYN, neurology, psychiatry, rehabilitation. That's a 7 category for the healthcare. So surgery is the most risk one. That's why when you have a surgery, we have anesthesiology to put the patient into sleep. Then we will monitor the heart rate, blood pressure, breath, body temperature. So we monitor that 4 basic items to make sure the patient's life and life quality will be preserved after the surgery. So this monitoring is called standard care. It's in the law, you must do it. If you not do it, it's not standard care. However, for my profession, I'm a neurophysiologist. 5 years ago, there's no this kind of a profession. So this is a new profession. What I'm doing is I'm monitor the nerve. Since any neurosurgery close to your nerve or within your brain, there will be a possibility or there will be a risk damage your nerve. The serious one will be the patient totally paralyzed. We call the quadro paralyzed. So that's my profession. However, since this is a new profession, right now we still did not have enough data to make a law to put the neural monitoring as a standard care. So if it is not a standard care, then the surgeon have an option. So the surgeon can choose to use the neural monitoring or not use the neural monitoring. Yeah. Also, the patient also have a choice. But I'm going to I'll give you one example why the neural monitoring is important. We know lots of people have neck pain. Our brain have the nerve which go down through spinal cord. Spinal cord is just a bundle of the nerve. So it go down from your brain, go down your spinal cord, go to your pelvic, and then will become a nerve, go to your leg and go to your arm. The spinal cord is segmented. Like your neck have 7 segments, your thoracic have 12, your lumbar have 5. So each segment have the nerve root come out. Then the nerve root become a nerve. Like you have a medial nerve, ulnar nerve, fibular nerve. So those nerves come from a nerve root. The spinal cord, the vertebrate body like this. This is the front, this is your back. So the spinal cord goes through your spinal canal behind the vertebral body. Between each vertebral body, there's a disc there. The disc is not a bone. The vertebral body is a bone. So the bone, between the bone, there's a disc. The disc like a soft tissue. It gives your spine kind of flexibility. However, when you get older, the disc will degenerate. When the disc degenerated, it will go away, not in the right position. So if the disc go back, it will push your spinal cord. If it go lateral, it will push the nerve root. So when the disc degenerated push the either nerve, you will have a numbness, tingling in your hand and your arm. So at that situation, not your arm or your hand is wrong, it's something back to your spine gets wrong. So how can we treat that? The surgery doing that is called ACDF, anterior cervical discectomy and fusion. So the surgeon incision from the front of your neck, open it, find the disc, and then he will take off the disc and put an artificial one. In that way, your nerve will not be suppressed anymore. So when the surgeon doing that case, you know the nerve and the other tissue, they are the same color. You cannot identify it by your eye. The surgeons are very experienced. They have been training like 10 years before they can do that independently. So even though at that situation, there's still risk to damage the nerve and the patient gets paralyzed. That's why they need a neurophysiologist to monitor the spinal cord, to monitor the nerve root. So for the risk, I mean, how many people being get paralyzed? That is about 1% of people could be paralyzed. So for the cost, technician doing this case, average is $600. But if the patient gets paralyzed, the spend would be $120,000. That's not to include the lawsuit. If we involve a lawsuit, that would be million. So after this presentation, if you are a neurosurgeon, you are not using neuromonitoring right now, I hope you will consider that. So if you are a patient, definitely you sure you want to be monitored during this surgery. Mr.